What is it like to build a world-changing healthcare company? Today we're sitting down with my colleague and YC Group partner Surbhi Sarna as we hear about her journey into building nVision Medical into a startup acquired by Boston Scientific for over $275 million and having a big impact on women's health in the process. Let's get started. Many startup founders started by seeing something other people just didn't experience. Surbhi's story is one of the most intense ones I've heard in startup land, and it starts with a sharp pain in her side in high school.
I was writing a paper on Emerson in my bedroom when all of a sudden I felt such a sharp pain in my side that I could barely make it to my mom and say my side hurts before blacking out. And the next thing I remember is waking up in the hospital. Of course, I didn't know it then, but it was going to be the first of many trips. Eventually, I found out that I was suffering from repeat complex ovarian cysts, but it took months and months more before they could tell me whether or not those cysts were cancerous. So from the lack of therapeutic options to the despicable state that the initial diagnostics was in, I realized that women's health isn't where it should be, and sort of this dream formed that maybe one day I would be able to start a company dedicated to women's health, and specifically the early detection of ovarian cancer.
That was the experience that set her on a path to figuring out how to solve something truly important to her.
I remember in high school writing my personal statement to the UCs saying that I wanted to start a company dedicated to women's health. So at that point on, everything that I did, every decision I made, I thought, how does this decision that I'm making now bring me one step closer to starting that company? Early on in my career, I knew I needed to kind of reach into every functional area of what it takes to run a healthcare company, to understanding sort of not only the innovation itself, but the regulatory climate to reimbursement and everything else.
That's one of the most important lessons for future founders. Once you know you want to solve a real problem, you need to start orienting the steps in your life to be able to create the thing that you want. How to build it, how to sell it, how to work with regulatory bodies, and how to bring it to reality. When Surbhi finally did get started on her own startup, one of the first things she ran headlong into was how to get in touch with customers. In the healthcare field, this was doubly difficult because you need access to both healthcare providers and patients eventually to even understand what to build.
So after doing a lot of reading in the women's health arena and really trying to focus on early detection of ovarian cancer, an idea in that specific space, in that clinical indication of ovarian cancer, still hadn't clicked for me. But what I uncovered as I was reading these journals on women's health is that there was another unmet need, which was the detection of blockages in the fallopian tube, which is the leading cause of infertility in women. And so I had this concept and I thought, wow, instead of injecting dye during an X-ray procedure to see if the fallopian tube is blocked, what if we put a micro catheter through the fallopian tube to look at these blockages?
Steve Jobs said, creativity is just connecting things. When you ask creative people how they did something, they feel a little guilty because they didn't really do it. They just saw something. It seemed obvious to them after a while. Surbhi found what she thought was a Eureka moment, a connection to something that had never been done before. But she still needed to get in front of customers and the medical establishment to even begin. While she had connections from years working in cardiology, she still needed to build up her connections in women's health. It turns out the first connection wasn't far away.
I realized that I do in fact know one gynecologist, my own. At first, I called her office and I just said, hey, I'd love to talk to Dr. Cook about this new innovation. Click. They thought that I was someone trying to sell them something yet again. So I thought about it for a little bit and I called back, feigning a little bit of a stomach ache and asked if I could see Dr. Cook. And in the middle of my examination, I said, hey, I have this new catheter concept I'd love to run by you. I'm not sure she's ever been in that situation where a patient was then pitching a new concept, and she did not agree to speak to me, at least in that moment. But she did say that, hey, if you want to meet me at this cafe in downtown Saratoga, I would be happy to meet with you and talk to you then. And so I'm glad that I made the effort to talk to her, the only potential customer I knew, because she then introduced me to dozens more physicians, and each one of them introduced me to somebody else. And even when they disliked the idea or thought it wasn't feasible, I learned something. And the ones that did like it were more than happy to introduce me to more and more prestigious institutions until the head of women's health at Stanford was willing to join our advisory board.
The journey of 1,000 miles starts with a single step, and I love this story of how Surbhi just got started. Figure out something that could be a real problem, then become a heat-seeking missile for people who can help you validate that idea and move it forward. When you're trying to do something hard like nVision was doing, it really requires a real scientific breakthrough.
The fallopian tube is only 1 millimeter in inner diameter, which means you can't actually put too much in it. So we used a balloon to capture these cells, but no one knew if cells adhere to the outer surface of a balloon. No one had ever navigated the fallopian tube before, and no one had used this balloon technology to capture cells anywhere in the body.
It was years of trial and error to achieve this feat. Surbhi and her team walked through thick and thin to figure out how to do what no other scientist had been able to do before.
I remember driving up to a sheep farm in Northern California for 2 hours to get some sheep fallopian tubes that they discard after they slaughter the animal for meat, and then driving back in my car with this stinking up my back seat so that we could then do studies to see, well, are we able to navigate sheep fallopian tubes? Are we able to collect cells from them? And then we were. And so those little wins mean something, but as a scientist, what works on the bench doesn't necessarily translate to what's going to happen clinically. I still remember our very first case where we saw our device after years of, going from something that we drew at the back of a napkin to actually seeing the first prototype to working on the bench. I remember that first clinical study where the balloon was deployed and we saw it navigate the full length of the fallopian tube. I remember the physician finishing the case and then my whole team turning to look at me and just having a shocked look on my face, to the point where my VP of R&D thought that something was wrong. But in my mind, I was so happy, but also already thinking, so what does this mean? What's next?
Being able to turn an idea into reality was itself a huge accomplishment, but Surbhi still had to go raise $12 million to complete the studies to go all the way.
Finally nailed a term sheet after many rejections. And in the middle of those negotiations around the term sheet, not that it was anything too horrible that happened, but I did, with one of my earliest investors who led my A round, I did actually start crying on the phone, which was immensely embarrassing, to be honest, because, this is just a term sheet negotiation. What was going on? I was really confused about that moment, and eventually we got it signed and everything, but a couple of weeks later, I noticed that my appetite was shifting and that my body was shifting, so I got a pregnancy test and realized that without knowing it, I had been pregnant. In my first trimester, I'd been pregnant while trying to fundraise for this money.
Between that moment and a year later, at Surbhi's son's first birthday, they signed the deal to sell nVision for $275 million.
My dream, the reason I started the company, was to get this to patients. The first study that we did, all 5 times that cancer was present in the fallopian tube, our device was picking it up. And ovarian cancer, until this day, is one of the most lethal forms of cancer impacting women.
nVision continues to be in development and on a path to being brought to market to make a big impact in cancer and women's health. Today, I get to work with Surbhi day-to-day at Y Combinator, where she's a group partner working with many kinds of companies, including the ones focused on bio and healthcare. She's a wealth of knowledge, and her experience is incredible at bringing this idea, any kind of idea, especially hard ones, to reality.
When you know without a doubt that you're building something people want or something people need, and that the product you're building, especially in healthcare, is going to change the landscape for patients, and you have that almost anger behind it, that good indignation, you don't let others externally validate your company. The only people you do let in are the potential customers and all of the research you've done and the pain that you have felt personally or seen other people feel. And that's what kind of keeps you focused and keeps you going in the moment, which is another reason why folks should never try to be an entrepreneur for the sake of being an entrepreneur, because there are so many setbacks and so many hurdles. The other thing that kept me going outside of my good indignation were the couple of people who did believe in me. On this journey of entrepreneurship, you don't need everyone to believe in you, and you don't need everybody to get to a yes. You just need a couple of people to get behind you. And if you empower those people adequately and they empower you, you can move mountains with just that.
Surbhi has a new book coming out called Without a Doubt, How to Go From Underrated to Unbeatable, in bookstores and Amazon now. You can follow her on Twitter at Surbhi Sarna SF, and she also runs Y Combinator's bio program. If you're inspired by this story, please go buy Surbhi's book and know that YC is here to help you build your dreams. I'll see you next week.